Well, we've had breaking news on the coronavirus outbreak from Italy in the last couple of hours because the government is taking yet more drastic action. The entire country has now been placed under lockdown. Now, we already knew that 15 provinces, primarily in the north, would be under quarantine from Monday morning in order to try and contain the spread of this virus. But by Monday evening, that had been extended to the entire country. Bear in mind, Italy is the worst hit nation outside of China in the world. It has 463 deaths and close to 8,000 infections. Across the next half an hour, we'll bring you up to date from Italy, as well as from the US, Ireland, Israel, Iran, China, the UK, and elsewhere. The state of the crisis more broadly, well, these red graphics here mark where the biggest outbreaks are. There are now over 110,000 cases in more than 110 countries and territories. The death toll is close to 4,000 and more than 60,000 people have recovered. But we're going to begin in Italy in this extended quarantine that's been announced in the last couple of hours. Here's the Prime Minister.
Non ci sarà più una zona rossa.
There won't be a Zone 1 or a Zone 2. There will only be one Italy with a protected zone. We would then need to avoid movements across the whole territory, unless they are essential and motivated by three specific circumstances: work reasons, necessary reasons, or also health reasons. And we add to this decision a prohibition on public gatherings.
So to put this in context, these measures are the most restrictive in Italy since the Second World War. All schools and universities across the country, not just in the north, are going to be shut. Sporting events will be cancelled. Only urgent work or movement because of family reasons will be allowed. And that original isolation area just in the north has now been expanded. But of course, it contains Italy's financial hub, Milan. Here's one journalist's account of being there.
I think people are starting to wake up really to what is happening, not only because of the measures that have been taken, but also of the way they were communicated. I think the government is trying to make sure that people shouldn't panic with this, but at the same time, it's really important to be responsible in this moment. And hopefully now people are going to start becoming more responsible and just stay home as much as they can.
Now, not everything is ground to a halt. Some flights are still operating, trains are still running. And to be clear, access to this initially quarantined area in the north did not appear to be particularly strictly monitored. It seems as though tourists have been staying away despite the variations in restrictions. We know that tourism is worth in the region of, 60 million tourists come in, so many hundreds of millions of euros. So the economic fallout will be considerable. And we know the government's planning to pump billions into the Italian economy in order to deliver a massive shock therapy, to use their phrase. We can't really know if that's going to work for months, though. And as you'd imagine, right now, business owners are concerned.
My mother has a small business 20 minutes away from Milan with one employee and two trainees, and she felt that she would have to close her business for a month, and she was worried about her employees. But actually, our local authorities made it pretty clear that business can keep running, but the owner of the business has to guarantee a social distance of 1 meter among clients and visitors.
Well, Italy is a particular concern because of its large elderly population. It has the highest proportion of over 65s in the EU. By that measure, globally, you can see here, Japan has the most elderly population, Italy second, Germany third. And we know older people are by far the most at risk from this coronavirus. They also, of course, have the greatest need for healthcare all round. So we have a double concern: older people being exposed to the virus and the virus impacting on health service resources more broadly. Here's one Italian virologist.
This is actually the biggest concern that we have at the moment, because intensive care wards are being filled with patients, mainly with elderly people that have a severe respiratory form or a mild respiratory form, and they go to the hospital. And so the semi-intensive and the intensive care units are, they're just full. And what is happening is that they are reprioritizing the activities of the hospital of the hospitals involved, and this means that patients that had to have other types of surgery or other types of treatment don't have access to that treatment. So it's a very, very difficult situation.
This story is morphing into so many different types of crises. There have now been riots in 27 Italian prisons. The trouble began in the northern city of Modena, where inmates here had been told that personal visits were being suspended because of the virus. Trouble began. 6 people have now died there. We know there was a fire in one cell block. Others died from methadone overdoses after breaking in to the infirmary. If we go a lot further south to Foggia, well, over 50 prisoners escaped to prison there, although 32 have been recaptured. And next, got to look at the situation in San Vittore prison in Milan. Here you can see some inmates right up on the roof. Their banners have been calling for pardons for their crimes and better medical support to protect them from the virus. So 2 quite separate demands there. Outside the prison, their relatives have been joining the protests. So here's one prisoner's wife.
We see that our relatives have nothing. They have no masks, they have no treatment, they have nothing.
And about the situation in these prisons, here's Sofia Bettiza from BBC World Service.
Some riots are still ongoing in the south of Italy, but mostly things have now been contained. We've heard that about 6 people have died as a consequence, and those people that you mentioned, those inmates in the south of Italy, in Foggia, 20 of them are still missing, so they managed to escape.
And is the primary concern of prisoners that they can't be kept safe while this virus is spreading?
It's twofold. That's the main concern, but some of the protests broke out as a consequence of these new measures that you mentioned that have been introduced by the government, meaning that all family visits have been banned. And so inmates were reportedly very angry and started protesting as a consequence of that.
Now, this coronavirus is now testing economies, health systems, prison systems and governments around the world. The number of cases worldwide, well, it's over 110,000. As we've been discussing, the death toll is close to 4,000. But this is not just a health crisis, it's an economic crisis too. Share prices have nosedived today. We've seen the heaviest fall since the financial crisis in 2008. Have a look at the S&P 500. This is what happened when it opened for trading earlier. 500 of the biggest companies in the US down 8% within minutes. You'll see a similar vertical line for the Dow Jones Index. It features 30 of America's biggest companies, down 7%. In fact, prices fell so quickly, trading had to be paused, and when it resumed, there was no let-up. Here's Samira Hussain at the New York Stock Exchange.
The last few weeks have been really dramatic, but really what happened today was something that I had never seen on the floor of the New York Stock Exchange. Shortly after opening, we saw that the Dow had dropped by almost 2,000 points. It triggered an automatic stop to trading. It's this halt, this sort of safety mechanism that exists on the exchanges, that if there's a drop of 7% or more on the S&P, that the trading will stop for 15 minutes. It gives traders, it gives investors, everyone really an opportunity to sort of stop, to take a breath, to take stock of where they are.
Now here in the UK, the FTSE 100 had a similar story to tell. It represents the 100 biggest companies listed on the London Stock Exchange. It was down, its worst day since 2008. Or you could look at the main stock markets for France, Germany, Spain, all down more than 7%. This is Bloomberg's index of 40 companies on the Milan Stock Exchange. Another vertical line, a drop of over 11%. And one of the key drivers for all of this was the price of oil, driven by a standoff between Saudi Arabia, the second biggest oil producer, and Russia, the third biggest oil producer in the world. Now, Saudi Arabia is part of OPEC. That's a grouping of oil-producing countries. OPEC suggested reducing supply because demand has been falling because of the coronavirus. It asked Russia to do the same. Russia refused, so Saudi Arabia refused too, thus creating a glut of crude oil. The Financial Times puts it this way: Saudi Arabia has started a global crude price war, and however you want to define it, this is what happened. Another vertical line, the price of the barrel of oil fell 20% in a matter of minutes. Let's get the view of one analyst.
This is, hands out, an oil price war. The gauntlet's been thrown, the gloves are off, and that this is going to be the start of something major, and we're starting to see that already. It's a difficult time, and the OPEC deal that unraveled last week was the first step of all of this aftermath that you see today. The Russians have been long resistant to cut supply because they think that high-cost producers should be adjusting supply, not OPEC and Russia. The Saudi Arabia said that they would be willing to extend cuts even through the end of the year. And the Russians refused to allow, and the Saudis won't cut alone. So lo and behold, you had OPEC, the deal unraveling last week, and then you had the Saudi Aramco April barrels being priced over the weekend with significant cuts to their exports.
Well, let's look at how these huge shifts on the oil markets and the stock markets are impacting on people's lives. Here's our economics correspondent, Andrew Walker.
Many people do save directly or indirectly in the stock market. People do buy stakes in investment funds, and also there's their pensions. If you have an occupational pension that's run by your employer, it almost certainly will invest at least some of the money in the stock market. Not exclusively, some of it will invest in company debt, but company shares are a very important part of it. And if you were to have a sustained period of poor performance in the stock market, then the pension fund might have a problem, which it might need to deal with either by reducing the pension benefits that the members get, or by asking for more contributions from the members who are still in work or from their employers.
There may be some people watching thinking, well, OK, it's been a dramatic day, but markets go down, they go up. When would we know if this is actually a slightly more fundamental reset?
I think that's the kind of thing you can only really judge with the benefit of, I'd say, probably several years of hindsight. And I think what will drive it more than anything else is how quickly the world gets on top of this outbreak, and how effective governments and businesses are at containing its economic consequences.
We're going to focus on the United States now. In late February, President Trump told us the 15 within a couple of days is going to be down to close to zero. That's a good job we've done. Well, those 15 cases haven't gone to zero. The latest figure we have is 607 cases in the US, in 34 states, and in Washington, D.C. too. There have been 22 deaths. Yet the president's been tweeting in the last few hours, the fake news media and their partner, the Democrat Party, is doing everything within its power to inflame the coronavirus situation far beyond what the facts would warrant. Well, as I was mentioning, the facts are there are over 600 confirmed cases. The president also said this when visiting the Centers for Disease Control at the weekend.
I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, how do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president.
We'd give a penny for the thoughts of those scientists standing alongside the president. Bear in mind, in this same press conference, President Trump admitted that before the beginning of this COVID-19 crisis, he'd been unaware that people die from the seasonal flu. He also said this about the availability of test kits.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test.
But that's not true. Last week, Vice President Mike Pence says we don't have enough tests to meet what we anticipate will be the demand going forward. Now, federal officials are saying more than 5,000 tests have been conducted, but sometimes one individual requires more than one test, so it doesn't mean that 5,000 people have been tested. A recent tally by The Atlantic magazine estimates that 1,900 people have been tested in America. Just by way of comparison, South Korea is testing 10,000 people every day. We've also had this update from Representative Matt Gaetz saying he's been informed today that he came into contact with a CPAC attendee, this is a Conservative political gathering, 11 days ago, who tested positive for COVID-19. We're told he's now self-quarantining. Bear in mind, this is the same politician who tweeted this last week, mocking people who were worried about the virus. So he's shifted his position a little. Also in the US, there's been an awful lot of attention on this cruise ship, the Grand Princess. Here it is coming under the Golden Gate Bridge. We know there are 21 cases on board out of several thousand passengers and crew. It had been sitting off the Californian coast awaiting instructions since last week. but in the last few hours it has come into the Bay Area and docked. Passengers are now going to be allowed to disembark. We know preparations have been underway for when that happens. They are all going to be going into quarantine. This is one passenger.
So the people that already tested positive will go ashore first, as well as people that are showing symptoms. Then the Californians, which is our group, and after that, I don't know.
All of this is happening despite President Trump saying this yesterday.
Big monster ship that's out there right now, which, again, that's a big decision. Do I want to bring all those people on? People would like me to do that. I don't like the idea of doing it.
He's not keen on the idea, but that's what's happening. If we go in closer on the Bay Area, you can see we've marked the port of Oakland, just across the water from San Francisco. The BBC's Chris Buckler is there.
The ship docked a short time ago, and just behind it, behind me, there are tents set up, there are medical teams waiting, and the whole idea, first Rose, is to get those who are sick with the coronavirus or displaying symptoms off the ship first, specifically to get them to local hospitals to ensure that they get treatment. After that, it's going to be a pretty long process. It's probably going to take a couple of days. They're going to take the Americans off. The Californian residents are going to stay in this state. They're going to go to a military base where they will spend 14 days in quarantine. The other Americans will be taken to military bases in Texas and Georgia. And then there's the whole issue of the international passengers. They will be taken off the ship and they will be taken back to their home countries. Now, some plans are still being made for that.
Well, as well as meeting health officials, President Trump also had what The Hill called a golfing Saturday, and it shared this video from Trump International Golf Club in West Palm Beach in Florida. And as always with Mr. Trump, there is a tweet from the past to go with this. Here he is in 2014 attacking President Obama. He says there's a major meeting on the Ebola outbreak in New York with people flying from all over the world, but he's decided to play golf. And President Trump, as he often does, decided to play golf this weekend. And that and a whole range of other things means there are quite a few questions about how he's handling this crisis. Here's the New York Times with the headline, "For Trump, coronavirus proves to be an enemy he can't tweet away." Then you have this from Wired. Trump's coronavirus press event was even worse than it looked. Jay Rosen, an academic in the US, says, "After watching the clips, I've just rewatched the entire event. That press conference is one of the nadirs of American democracy, an emergency siren in itself." Or you can read The Atlantic, which says the US isn't ready for what's about to happen. Needless to say, President Trump and his supporters do not buy into that. Earlier, the president simply tweeted, "So much fake news." But on the issue of how he's handling this, here's Chris Buckler again.
What we're seeing are mixed messages coming from senior White House officials, from health officials here in the US, who are saying very clearly, as far as they're concerned, Rose, that people must be very aware of the coronavirus. Yet at the same time, although we've had these visits by President Trump, and you saw there going to facilities, talking about how concerned and how much action is being taken, he then at times seems almost dismissive of the threat of COVID-19. In fact, take a look at another tweet that he said recently. He said, for example, today, "Nothing is shut down and life in the economy goes on. At this moment, there are 546 confirmed cases of coronavirus. Think about that," and comparing it to the number of people who had died from the flu. But of course, the coronavirus is only just spreading. And the reality is the administration is being accused by Democrats of being slow in terms of addressing this. And certainly, I at the weekend was in Seattle and Washington, where there has been a major outbreak. And there is no doubt for people, and particularly in positions of authority there, that they feel it has been slow in getting them resources that they badly need, particularly testing kits.
Now let's take a few minutes to update you on a range of other countries affected by this outbreak. First of all, to Ireland, because the government has cancelled all St Patrick's Day events. There are 21 cases in Ireland so far, but the concerns were if there's an event like this was last year in Dublin, around 500,000 people turned out for the St Patrick's Day parade. These kind of events could help the virus to spread more rapidly. From Ireland, we move to Spain. The government today announced that all schools and universities in Madrid are going to be closed. That will affect more than 1 million students. One of the main outbreaks in the world remains in Iran. The death toll there has gone past 200, but there are major concerns the real figure is much higher. In an effort to fight the spread, Iran's supreme leader has now cancelled a major speech to mark Iranian New Year. That was due to happen later this month. It won't happen anymore. And we've had a tragic example of how misinformation is becoming a huge part of this crisis. More than 30 people have died in Iran from alcohol poisoning after rumours that drinking alcohol would ward off the virus. Next, we turn to Israel, which has been announcing updates on its position daily. The government is now saying anyone who comes into the country has to self-isolate for a 14-day period. Well, as we've done every day during this crisis, we've heard from the World Health Organization. Let's get their update today.
Now that the virus has a foothold in so many countries, the threat of a pandemic has become very real. But it would be the first pandemic in history that could be controlled. The bottom line is we're not at the mercy of the virus.
And that optimism largely comes from what's happening in China. As you'll know, this is where it began, particularly in Hubei province. And after taking hold in the city of Wuhan, the virus spread very, very quickly, as this graph shows. Through January and February, the number of new cases was growing and growing. But have a look at this in the last few days. The number of cases has pretty much flatlined. Very few new cases. Here's our correspondent, Stephen McDonnell, on how that's happened.
Outside of one city, that's Wuhan, in the rest of China, if you take out people who've come into the country from overseas who've been infected, for 4 days in a row, there have now been 0 extra infections. Now, just think about it. That's just like weeks after we had a situation where 80,000 people were infected, and it does seem to show that these quite strict measures being put in place by the Chinese authorities are working in terms of slowing the spread of this disease. You know, apart from locking down Wuhan city, all of Hubei province, 60 million people not able to leave, quarantine provisions in Beijing, where I am, in cities right across the country. And so right now, you have people gambling on the stock market, on various stock markets around the world, worried that there is going to be short-term pain. Well, another possibility is you look at what's happened here, and there is light at the end of the tunnel. You also sort of go from China to South Korea. Now, that was the next place to have a really bad coronavirus emergency. It also seems to be stabilizing there. So hopefully we can sort of see a pattern here that this is going to get much worse in other countries before it gets better. But that if this pattern is true, that it goes sort of China, South Korea, Italy, Iran, elsewhere, eventually those places will also stabilize. But of course, we do need to consider that not every country has the same amelioration options available as those that the Chinese government has.